Hey, good afternoon, everyone. This is Phil Valentine. I'm the Executive Director of the Connecticut Community for Addiction Recovery, also in personal recovery since December 28th, 1987, puts me in my 29th year of recovery. Very grateful for that. So let's get right into this. And I think I can move the slides this way, right? I got it. That's me. All right, cool. So today's webinar is entitled Recovery Community Centers Stay in Your Lane. Let me give you a little background. A recovery community center, as CCAR has defined it over the years, we opened our first one in 2004, and as a matter of fact, last week our Bridgeport Center celebrated 10 years with a big celebration. We define recovery community centers as a recovery-oriented sanctuary anchored in the heart of the community. We put a face on recovery. We provide recovery support services, a large variety of those, and often a volunteer force delivers these services. We serve as a physical location where the local recovery community organizes care for others. So it's all about care. And it is not a place for people to simply hang out, watch TV, play cards or pool, and attend a daily meeting. We are not seeking to duplicate existing resources. And a lot of this, at least in my experience, this is kind of what AA clubhouses or other 12-step clubhouses have tended to be. Very viable things in a community and necessary, but a recovery community center is different. Uh, we maintain a structured schedule, and we want to offer a variety of recovery related workshops, trainings, meetings, services, and social events. Last month we talked about all recovery meetings, a real staple of our recovery community centers. You can find these workshops, trainings, and educational sessions to enhance one's own recovery, and we always are hosting specific recovery-oriented, alcohol and drug-free, clean, if you will, social events. We target people in recovery, family members, friends, and allies, anyone who supports the recovery lifestyle. And a recovery community center is a place where a person with long-term recovery can be of service and exists as a recovery resource for the local community. So that's a little background. Let me give you a little backstory. Over the years, as we've been running recovery community centers, we realized that um, there were times when we were trying to do too much, TOO, too much. We were trying to be too many things for too many people. And so because of that, we started to work on characteristics of a recovery community center, and we wanted to distinguish it between um, four entities and a drop-in center, a 12-step clubhouse, which I previously mentioned, a recovery community center, that's our lane there, that third column, and an addiction treatment center. So what we're going to do in the 30 minutes here, I'm going to fly through these. We're going to talk about a bunch of characteristics. And so, for example, this very first characteristic we want to talk about is the primary target audience. A drop-in center is people primarily with mental health issues, people who are homeless. Traditionally, that's what they've been designed for. 12-step clubhouse, obviously for members of a specific 12-step fellowship. A recovery community center, people in all stages of recovery from alcohol and other addictions. That is what our focus is on. People in recovery, and I would even go much so far as to say as people who have initiated recovery from alcohol and other addictions. And an addiction treatment center targets people who are still actively using or in very early stage of recovery. Make sense? Now I know there's lots of carryover, a lot of things, I can't think of the right word, but fall into other categories. So these boundaries are gray. These are general characteristics. So please bear with me. These are just to give you an idea of how we've determined what a recovery community center is. If you have any questions, I'll answer those. You can put those in the chat box in the bottom corner of your screen. With me so far? Nod your head if you're with me. Thanks. The secondary target audience. We had a primary target audience and a secondary. Drop-in center, people with co-occurring addiction, mental health issues. 12-step clubhouse really doesn't have any. And recovery community center, the secondary target audience are people seeking recovery, family members, friends, and allies. And addictions treatment center, family members are the secondary target audience in some settings. Make sense? You with me so far? And so here we go to the next characteristic, core services. And a drop-in center is usually about crisis response or focus on immediate basic needs of the individual, like food, clothing, shelter, and it's a place to hang out and be safe. 12-step clubhouse, it's really about sober social fellowship, mutual aid meetings, 12-step meetings, if you will, and meeting rental space. So they rent their space out sometimes. Recovery Community Center is about peer-based, peer recovery support services, advocacy, and public education opportunities and social activities. An addiction treatment center is those clinical terms of like assessment, diagnosis, treatment planning, treatment services, continuing care. And also our lane is right in there. The next characteristic we want to talk about is the culture and tone. A drop-in center is variable, often perceived as a place to have immediate needs met in and out. The 12-step clubhouse is a 12-step environment, signs, slogans, language, meetings, fellowship, sanctuary. I know there's a place in Manchester, Pathfinders Club, that was traditionally known as 12-step clubhouse. They're moving more towards a recovery community center now, but they have all the 12 steps on the wall, AA slogans like live and let live, this too shall pass, one day at a time, easy does it. To me, those are very heartwarming and comforting. The Recovery Community Center embraces multiple pathways to recovery. Uh, it's a sanctuary, it's a hope, it's caring, it's healing, it's recovery task oriented. Um, there's fellowship there, there's all kinds of opportunities promoted, whether those are working opportunities, volunteer opportunities. But we like to keep it warm, engaging, and welcoming. An addiction treatment center is often seen or perceived as sterile and hospital-like and very clinical in nature. It's also interesting to note that sometimes it's much easier to access a recovery community center. There are no assessments done, simply the question is asked, how can we help you with your recovery today? Uh, the service support framework for a drop-in center is really not recovery oriented, it's more needs based. The 12-step clubhouse operates within the beliefs and practices of a 12-step fellowship. And we have a reference there. There is something written by AAC, AA guidelines, relationships between AA and clubs for more. So you can look that up if you want more information on that. And the Recovery Community Center really works across multiple frameworks of recovery via the choices of those with whom we work. An addiction treatment center works within a particular organizational treatment philosophy, can involve 12 steps, it might be something else as well. So multiple pathways of recovery. When I say that, 12 steps are included as one of the pathways. They're not excluded. They have been very effective, but it's just one of many pathways. The next characteristic we want to talk about is assessment. And I talked briefly about this earlier, but a drop-in center really has none. 12-step clubhouse really has none. A recovery community center says, how can we help you with your recovery today? And the assessment is gradual, it's informal over the duration of the relationship. It may include strength-based recovery capital needs assessment, so which could result in a recovery plan. So there is this idea that that you can pursue your own wellness plan or do your own assessment of where you are in your recovery and formulate a plan to improve on one of those areas. Addiction Treatment Center, the assessment is immediate upon arrival, it's formal, it's comprehensive, it's documented, results in a diagnosis and a treatment plan, and it's pathology based. I remember a former commissioner in the state of Connecticut. He did one of those undercover boss things, and he went into a treatment center, and literally his dining room table was filled with papers that a person had to sign in order to get in to the treatment center. And think about what condition most people are when they need to access treatment. Are they in any condition to comprehend and sign, dozens and dozens of papers? Um, a lot of paperwork in that setting. Another characteristic is the recovery focus. The drop-in center is limited to none. The focus in a 12-step clubhouse is on maintenance and sustainability. So we always say at CCAR, like in a recovery community center, maintain and sustain recovery. And then addiction treatment is awesome here in Connecticut, especially. I don't know about your state or wherever you are, but addiction treatment centers are awesome at initiating recovery. So the initiation occurs in a treatment center, and oftentimes recovery is maintained and sustained in 12-step fellowships or recovery community centers or in the clubhouse. Make sense? So we only have about 500 more of these to go, and we'll be done soon. No, I'm just kidding. So the role of the community in recovery. The drop-in center really has minimal role of other people in recovery in the drop-in center. It's usually just the staff. The 12 steps clubhouse, it's intrapersonal and interpersonal. So it's minimal focus on the ecology of recovery, and there's no advocacy. So I say interpersonal. It's the relationships you have with yourself and with others, and the ecology of recovery is about the surrounding, the community, the environment, the recovery landscape, if you will. The Recovery Community Center really focuses on linking to community resources and building recovery capital in the individual and in the community. And it's a significant public awareness and advocacy work is involved. Addiction Treatment Center focuses on those intrapersonal and interpersonal relationships, minimal focus on the landscapes of recovery where people are going to return to, and there's minimal advocacy. The next characteristic we want to talk about is the training on recovery. Drop-in center, none to minimal. 12-step clubhouse is, or sometimes they have groups, and it's focused on 12-step training. AWOL might be one, for example, that's used there, or Joe and Charlie Big Book Study. Recovery Community Center, they talk, the training is extensive, it's varied, it's comprehensive, there's a wide variety of topics, and it's based on the community's needs of what people come in and are asking for, or what somebody might be willing to offer and wanting to try, and see how people respond. What is the response to it? So there's things like financial management, relationships. There's so many more that it's hard for me to think of them all. But we have many, many examples of the different types of recovery training in a center. An addiction treatment center, historically minimal, but now it seems to be increasing a little bit. The majority of the training is focused, though, on addiction. Things like I remember when I worked at a treatment center seeing movies like I'll Quit Tomorrow or The Hidden Tiger or Chalk Talk, Father Martin, those kinds of things. That just dates me a little bit, doesn't it? So other characteristics are, one other is the knowledge base. And a drop-in center it's a mix of experiential and professional. 12-step, the people you find there are mostly all experienced with 12 steps. Recovery Community Center is mostly experienced now, but there's more and more pressure to professionalize the people who are the staff in these centers. And in Addiction Treatment Center, it's professional and scientific knowledge. CCAR has done a lot with recovery coaching, and we talk about the art and science of coaching. Addiction treatment historically has been based on the science, and people have left to develop the art. But however, the art is not assessed oftentimes in like getting certification or licensure. And CCAR is now looking to establish their own recovery coach license, or not license, certification, which will begin to assess the art of recovery coaching. Do I have your interest? I hope so, because my voice stopped. Okay, back. I'm back. Stacy said my voice stopped. Whoa, that's a little frightening. My voice stopped. Anyway, so the next characteristic is the corporate status. And a drop-in center is usually nonprofit. And where did it go? It disappeared. Okay. The 12-Step Clubhouse is nonprofit and it's membership based. The Recovery Community Center is also nonprofit. For them, I believe all that I'm aware of are nonprofits and membership based. And addiction treatment, they vary from nonprofit to proprietary for profit. I'm not quite sure why this one keeps the service support relationship. The drop-in center is a moderate power differential. This is between the staff and the people who are coming in. And there's moderate external accountability. So who does a drop-in center report to, or who are they accountable to? Moderate levels there. 12-Step Clubhouse, you can see almost as equal as soon as you walk in, a minimum power differential. The support is reciprocal by the people coming in and the people giving it. I'm not even touching that, and it keeps moving around. Huh? Yeah, well, help. No, we're back to corporate status. I don't know why we keep going back. Huh? I'm sorry about, no, now we're going back. It went forward. I'm not even touching anything. Here are my hands. See? This is where I am. So there's minimal power differential in the 12-Step Clubhouse. The support is reciprocal back and forth between the people coming in and the people that are in the 12-Step Clubhouse. There's minimal to no external accountability. They're accountable to themselves. The Recovery Community Center also has that minimal power differential. We try to keep everything on an even keel. We've been there. How can we help you? Ethical guidelines being developed as we speak. We have some ethics for our volunteers, of course, and there's moderate external accountability. And right now, that accountability is to our funders, rightly so. We do receive state funding. An addiction treatment center, there's a significant power differential between a person coming in presenting with an addiction issue and, let's say, the counselors and frontline staff. The counselors are held to explicit ethical guidelines, and they have very high external accountability to their funders, to their outcomes, to the people they bill for services, and to the families. So there's a great deal of accountability in an addiction treatment center. The next characteristic we'll talk about is the style of helping, and this is fascinating to me too. That a drop-in center ranges from formal to informal. 12-Step Clubhouse is informal, open, and spontaneous. A recovery community center is variable by the organizational setting, but generally people try to keep it very personal and informal. And an addiction treatment center, the style of helping is formal, personally guarded, and strategic. Makes sense? And the use of self. So in a drop-in center, self-disclosure usually limited and discouraged, and sometimes it doesn't even come up. In a 12-Step Clubhouse, there's a strategic use of one's own story. We tell our stories all the time, and there's a certain role model expectation. The same is exactly true in a recovery community center, that the strategic use of one's own story, when it's about the person you're helping, not about you, and a role model expectation that, hey, we've been in recovery for a while, you're starting on your path, how can we show you the way? How can we coach you along your way? And these are generalizations. In addiction treatment centers, for the most part, self-disclosure is discouraged and it's monitored for strategic value or prohibited. Monitored for strategic value at the best, and sometimes just flat out prohibited. If a person is in recovery, you're not allowed to say so if you're a counselor in a treatment center, which is kind of ironic given that back in the 70s and early 80s, 80 to 90% of everybody that worked in an addiction treatment center was in recovery. Some people have told me that have come from all over the country while I'm doing the Recovery Coach Academy that the reverse is true now. I don't really know that they're saying it's 10 to 20% of people in recovery actually work at treatment centers. Another characteristic, what are the volunteer opportunities across these four? The drop-in center, none to moderate. Sometimes they have volunteers. 12-step clubhouses, yes, it's all volunteer basically. For most of them, there's an informal system, no formal recognition for volunteers within the specific fellowship, and high level of it's a very high level for volunteering, probably the highest. Uh, and I really don't know what's going on. Is my voice back? Is that you or me? We don't know. Okay, maybe I gotta like move around a little bit. Um, but Stacy keeps letting me know that my voice stops. So can they hear you too, or do you know they can't hear you? Stacy's like the wizard behind the curtain. Volunteer opportunities. So the Recovery Community Center is almost exactly the same as the 12-step clubhouse. It's yes, it's a formal, but we have a formal system and we have formal recognition, multiple, usually written out opportunities, and a very high level of volunteering. It's really what drives the CCAR Recovery Community Centers. The addiction treatment centers has minimal volunteer opportunities. Some of them are mostly with alumni programs. So we would classify that as a low level of opportunities. Once in a while, I mean, back when I first got in recovery, you go into treatment centers and run groups and things like that. But for the most part, or run AA meetings actually, or NA meetings, and that has not happened as much in the last several years. Another characteristic is a temporal orientation or time. Drop-in center is focused on the present. How can we assist you today? The 12-step clubhouse is variable by fellowship and stage of recovery. Recovery Community Center is also the focus is on the present. And the Addiction Treatment Center, it's usually focused on past experience and problem-solving strategies. What is the duration of support and service relationship? How long do these go? The drop-in center is variable. The people can keep dropping in as long as they need to. 12-step clubhouse, it can span years, but it's always determined by the individual. Again, the recovery community center, it's variable, can span years, and again, it's determined by the individual and once in a while the organization. Addiction treatment center, the relationship is usually short term with a beginning, middle, and end, and it's usually based on payment availability and or clinical guidelines. And there used to be times when the dose of treatment is still seems to be getting shorter and shorter, not longer. And what Bill White has indicated is that the field has never been very good at assessing the dosage or the level of treatment needed to match the addiction. The characteristic of documentation in a drop-in center, there's minimal. They might track the number of people that come in. 12-step clubhouse, I haven't seen any. Maybe there's some, but there's none. And Recovery Community Center, there's minimal for those providing service, but it seems like it's growing as the demands for data become more and more. The Addiction Treatment Center is extensive. I can't tell you how many times we've had clinicians say that anywhere from 90 to 95% of their time is spent doing paperwork. That's hard for me to comprehend. You become a counselor and to spend 9/10 of your time doing paperwork doesn't make a lot of sense. You went to help individuals and to talk to individuals and listen to individuals to help them. So anyway, the sources of funding, Drop-In Center is usually grants, foundations, ministries, public funding. 12-Step Clubhouse, membership dues and donations. Recovery Community Centers has a huge variety. It goes anywhere from grants, contracts, fee for service, insurance, individual giving. That's kind of when we did our little assessment across the country. An addiction treatment center, it's fee for service, insurance, grants, self-pay, individual giving as well. The characteristic of computer access is Drop-In Center has none to minimal for the most part. 12-Step Clubhouse, none to minimal, but that might be growing as well. I think one of the key characteristics of a recovery community center is, yes, we have access to computers and you're welcome to use them. An addiction treatment center usually has none and or may be prohibited from accessing the internet or during inpatient treatment. So you're not even allowed to go on a computer. Sometimes only able to use one phone as well. And paid staff, Drop-In Center primarily, 12-Step Clubhouse very minimally, if there is any. Recovery Community Center, variable, mixed with paid staff and volunteers. And again, Addiction Treatment Center is primarily paid staff. So a few closing thoughts. These are some of the characteristics that just run about how a recovery community centers stay in your lane. And these are based on our 10 years of working with recovery community centers, not only here in Connecticut, but seeing and talking with recovery community centers all across the country. And I think it's important to sometimes people want to do more of the treatment and focus on a target population of those still actively using. One time we had many homeless people coming in. We were trying to serve them. That didn't work so well. And other times people have a very strong 12-step clubhouse orientation where all that's practiced is 12-step meetings and that philosophy. And as far as the Drop-In Center, I'll have to go to my colleague who runs the Bridgeport Recovery Community Center for many years. He did a phenomenal job of bringing in donations of men's suits. And so these were nice suits, but soon there were people dropping in from all over the community, the Bridgeport community, to get these suits. And the recovery focus was starting to become compromised. And so that's why that category was in there as well. Is that a tremendous service for people? Of course it is. But did it take away from the focus on recovery from alcohol and addiction? We think it did. So I have a little bit of time if anybody has any thoughts or questions, but that's it for me. Anything, Stacy? You got anything? All right. Well, thank you for your participation. And again, if you have any questions, you can always email me at Phillip, Phillip, @ccar.us, ccar.us.